Well, good morning, everybody. Welcome to the Albany County work session, ARPA funding for the nonprofits. It is a little bit after 9, and late as everybody joins us here. Looks like Ted's just joining us. Bailey, thank you for the update on this stuff. Maybe we'll just start out with you with regard to premium pay. Could you give us a little background on that?
Yeah.
And, so that everybody know, when we were at the county, we prioritized premium pay before we did anything else. And so I'm guessing there were people and organizations that didn't know if they qualified or might not have qualified, or who knows. And so Bailey, give us a little bit on premium pay, and then if anybody here in the room or online has a question or a concern, just raise your hand and we'll get you recognized and we'll go with the question. So Bailey, please.
Yeah. What I had recommended to the commissioners is that any nonprofit who is thinking about offering premium pay to their employees with this ARPA funding to follow exactly what the county did. What the county did is we did $200 a month for the months from April 2020 to June 2021. This was $200 a month for each full-time person. Under that, if the person was not full-time, our accounts payable took some percentages of like the time they actually worked that month, and I can get more details from her when we move forward with that. But some of the requirements for somebody to be eligible for premium pay is they had to have worked during that time. So if they only worked January 2021 to June 2021, then they'd only be eligible for January 2021 to June 2021. They would not be eligible before that. Another thing is the business did have to stay open. Whether you were just had your workers inside and were doing things at your front door, or you were fully open and you had customers in, however that works, you did have to be open. And the employee still has to be employed. So they had to be employed during that time, and they still currently have to be employed with you. You can't give somebody funding who has left in the past month or whatnot. And I think those are the main requirements for premium pay. Tracy, do you know if I'm missing anything?
I think you covered it very well.
Yeah.
So any questions? Yeah, please.
Yes, I do have a couple. Thanks, Bailey.
Yeah.
Do you mind going over the time frame on the dates on that again? I didn't catch all that.
Yeah, it was April 2020
Thank you.
to June 2021.
Perfect. And then does that connect with telehealth? With businesses then that moved remotely and stayed open remotely, were provided medication management, minimized our face-to-face interaction, but still continued with telehealth?
Technically, no. It says may not, in the interim final rules, there's a statement in here that says may not receive premium pay for telework performed from a residence. So if they were, I would take it as if you were still working in the building and then you were offering those services, I would think that would qualify. What do you think, Tracy?
I would think so, if that was part of the normal services offered, because I think public health, if they have a telehealth service prior to COVID as well, or some form of that for veterans, wasn't there a veterans?
So if they were at their home performing those services, probably not, or they're not eligible. But if they were in the
Work at their
office,
apartment,
yeah.
from that face-to-face interaction. Okay, thank you.
Bailey, is that April 1, 2020 to June 30, 2021, or is it to June 1?
June 30th, 2021.
Okay. Any other questions about premium pay? My thought, Sue, is if people didn't put in for premium pay but do qualify for it, that they could submit that to us. What's your thought about
Especially
that?
because they weren't aware of it. So
Any other questions about premium pay?
Well, and then I believe I'd let you guys know that it probably will change requested amounts a bit, either, drop them down or increase them a little bit with what I've recommended moving forward with. Because I think some put in for some more and some put in less.
Okay.
And was that prior to you letting them know sort of the parameters?
No, I have not let them know the parameters because I wanted to check with you guys first. This was just after our conversation last Monday that we had, and more reading I have done that I think it makes sense to kind of just go across the board, make things more fair, not have one entity angry or anything. So.
And could you talk to us about the reporting part of that? What is a nonprofit need to be able to show you so that we can be in compliance with the federal government?
Let's see. The report, well, the federal government is still changing their mind about their reporting requirements. So at this point, what we would need to see, what Albany County did is we actually paid it out on a separate pay stub. It was a separate check that went out. It was not just part of their regular thing. We were able then to have that separate pay stub, which will then be able to turn into the federal government when they ask for it. Another thing that we do need is timesheets. We have to have timesheets from every employee. And those should be the only two things I need at this point, unless they come back and say, we actually need this and that.
If a nonprofit gives just monthly hour sheets, is that good enough, or is that something that's not all right?
I would think that would qualify as a timesheet. I think so. I think that'd be fine. The other thing is taxes are taken out of this pay, the premium pay that the employee receives.
Okay.
So you do have to take taxes out of this money.
Is that upfront, or is that each individual has to report that additional income? Will they receive it
The way the county did it is payroll just took it out of each individual, everybody's pay. So it would have been something before than the employee gets. Nonprofits are a different world for me, I'm not gonna lie. So this may be something I need to look into a little bit more if we have more questions that I can't answer, just because it is completely different to me. But yeah, I mean, Amanda here at the county just took out all the taxes out up front and then issued the payout to everybody.
Any questions online about premium pay, at least at this point? All right, well, any questions directed to you, Bailey? Is that who we should direct?
Yeah, so direct your questions to me or Evelyn. And I think the way we kind of want to move forward is if you guys are looking to do premium pay, to resubmit their amounts to me. And so list out your employees, if they're full-time, part-time. If we have questions on getting them, working out with the part-time employees, the amount they're actually getting, I can work with you on that. I'm sorry, it's Monday morning, haven't had coffee yet, so I'm a little out of it. Baby was up a lot last night. But yeah, just be in touch with me, get me that information, and probably before the next meeting that the commissioners decide to set. So, and we'll know that towards the end of the meeting.
Awesome. All right, thank you, Bailey. How do you want to proceed after that piece?
Let's just go down this priority sheet I had made up, like we did before.
Okay.
Or actually this one too.
I'm not sure if you guys had the use of this sheet that's in front of me, but just in case, we'll just run through some uses of the funds if you're not all aware, just so you can understand where we're starting our conversation with. So support public health expenditures. For example, COVID-19 funding mitigation efforts, medical expenses, behavioral health care, and safety staff, behavioral health care services, including mental health or substance misuse treatment, crisis intervention or related services. Address the negative economic impacts caused by the public health emergency, including economic harms to workers, households, small business, impacted industries in the public sector. Speed the recovery of impacted industries, including tourism, travel, and hospitality sectors. Provide premium pay for essential workers, offering additional support for those who have and will bear the greatest health risks because of their service in critical infrastructure sectors. Provide premium pay for essential workers, both directly and through grants to third-party employers. Prioritize low and moderate income workers who face the greatest mismatch between the employment-related health risk and compensation. Key sectors include healthcare, grocery and food services, education, childcare, sanitation, and transit. Equity-focused services and additional flexibility for the hardest hit communities and families to address health disparities, invest in housing, invest in educational disparities, and promote healthy childhood environments. So those are some of the main goals for the ARPA funding. And I guess we'll just start. You want to just start with everything red or yellow or green, Sue, and just go down the list, or how
Yeah,
would you?
let's do that.
Okay, so the first one we have is relative theatrics, the project title Empathy Laramie, just theater for all, 51,000. And I see you're up. Why don't you give us a little background, please? Good morning.
Good morning. Thank you. And yeah, good morning and happy holidays, commissioners. Thank you for taking the time today to dig in deeper to these proposals and to hear more and just give us this time. I really appreciate it. So yes, this project that we're proposing, and also I guess I'm all over the place this morning. I apologize. I wanted to thank you as well for the information session that we had before. That was incredibly beneficial for me just to see where a lot of priorities were at, to get a better sense on sort of funding timelines as well as restrictions. And so in review since that last meeting, we definitely refined our request and streamlined it, focusing the scope of the project down to really a project that from my view very much can meet these needs and meet the objectives of what this funding hopes to establish with this idea of rebuilding a stronger and more equitable economy as our country recovers. So we are proposing to produce 3 plays, 3 productions over the course of the funding period, where we are really focusing on highlighting all of the disparities that have been exposed, but putting it on a greater platform and really being able to amplify that and connect community to resources, and through that process to enhance the mental health and physical health of all those involved, whether they be attendees or participants in the creation of the act. Through various studies, people have found that those who attend performing arts events are healthier, have lower anxiety, and are less likely to suffer from depression. And it also leads to a greater understanding in the community and a greater sense of civic engagement and participation. But furthermore, when thinking about those that are creating the process, the product, my apologies, that theater has the potential to both help the actors and the audiences by providing information about mental illness, challenging stereotypes, reducing stigma, decreasing any sense of isolation, and providing role models and instilling hope. And so these are some of the really wonderful benefits that can come out of this process. However, there are numerous barriers that impede some of our most vulnerable community members to accessing these benefits of the participation in the theater. And so what this project that we are proposing with Relative Theatrics really focuses on an equitable approach that will overcome those access barriers, putting an emphasis on transit by setting up transportation to and from the theater, addressing food insecurity by providing meals at our events, healthy meals at that, providing childcare so that those that are engaged do not have to worry about a safe place for their children. And furthermore, with that childcare, we would be partnering and creating environments in which it is artistic for the children as well, so that there are benefits for their parents who are in the theater and for the children to have arts engagement through their childcare focus, so that they are getting those benefits as well. And then, I skipped over one thing. Oh, of course. For financial insecurity, we would be providing tickets and access for the audience to these theaters completely free of charge. And so that can really address a lot of those financial and I guess physical barriers to accessing the theater, but there also is a barrier of this sense of belonging, and that historically in the theater industry in this country, it has been a little bit of an exclusionary space. And so there's also, as a part of this proposal, a great investment in community building and relationship development with our neighbors, so that we can have them involved in the entire process of these most vulnerable communities, where they really feel that there is a place they can have a sense of ownership and belonging over the space of inclusion, rather than this idea of sort of, say we were to produce a Latinx play and just say, well, we've produced it, so they will come. But actually, getting in the community, on the ground, boots on the ground, like on the West Side at the Lincoln Community Center, having conversations about what they want to see on the stage and who wants to be involved as well. So getting them to be, a part of the creation process. And that's just one example. And so, yeah, that's sort of a broad overview. I feel like I'm a little bit all over the place, but I would love to address any questions that you might have and highlight other areas where I can dig in a little bit deeper for you.
At the end, Sue, any questions?
Yes.
Go ahead.
And specifically, these 3 theatrical productions, will there be a given time that is set aside for these families and children to attend? Because you're saying that you're going to provide food before the production. Is that going to be for every production and the general public, or are you going to have a performance specifically directed towards this population?
Sure. That's an excellent question. Yeah, that's actually what sort of the theater industry is calling affinity nights. I'll be honest, I don't quite agree with that titling, but I think that that's kind of what you're referring to. But this idea that we would have select blocks of the production period that are targeted and focused on these communities. And that is likely how, yes, the short answer would be yes. That would be the most feasible to coordinate. And I think also the way to create the most inclusionary environment for them that has that inviting sense.
Thank you, Anne.
Absolutely.
Anything else, Sue?
No.
Thank you, Ann. I appreciate it.
Thank you so much. Happy holidays.
Happy holidays. Next up, we have Hospice of Laramie, premium pay for eligible healthcare workers. And Jessica, I think you just joined in. Jessica, are you there? Maybe she did. I thought she did. Well, we'll skip her and let's go to Laramie Connection Center. Excuse me, the Laramie Connection Center. They have a Laramie accessible mobility project. Tim.
Are we coming here?
Wherever you'd like.
All right, yeah, just appreciate the time to kind of follow up on the requests. We've done a little bit more homework and research and prepared the budget that was submitted as well. And so as a reminder, as a continuation of the mobility services that Laramie Connection Center offers as a free service to our community, both for free medical and lifestyle transportation, which has been an amazing collaboration with so many organizations, from the hospital to downtown clinic to Live Health to Epson Center, Interfaith, even into private sector, doctor's appointments, things like that. Just wanted to kind of clarify that, it's our intent to expand that service by increasing the number of available vehicles and drivers, primarily for our rapidly increasing need out of town medical appointments. We actually have 2 volunteers that are on the road today, one to Cheyenne and one to Fort Collins, in response to medical needs for ongoing medical care. With that, we're just needing to see an increase in resources in order to keep the vehicles updated, even purchase maybe yet another one that could be added to the mix, as well as at this point needing to have access to some level of a hub for those vehicles. Right now, they're parked outside constantly, and just need a little bit more TLC as far as that goes. We do feel like this is applicable for ARPA, for the assistance to households, assistance to unemployed workers, aid to impacted industries, which is definitely transportation here in our community, and also to the disproportionately impacted populations and communities that have been affected over this last year and a half. We had slight adjustments to the original request, mainly because in our research of looking for a facility rental space, covered space for the vehicles was just a little bit higher than we had anticipated. So really open more to questions that you have at this time. We've continued to see just an incredible increase in the need for this. As a result, many of you know that we operate on what we call gap services. I mean that we recognize that we do have transportation available in town, but within each of its entities, limitations or hoops you have to jump through or things like that, we found a unique space to exist in offering the services as we do at this time. Open any questions or any clarification that you need on any details or where we're at.
Do any questions?
Yeah. Are your drivers paid or they work on volunteer basis?
So at this time, I'm the only one that's paid that does driving. We leverage all volunteers to do that at this time. With the increase, that's part of our mission, is to leverage the spirit of volunteerism. But with the increase, we are open to having to maybe bring a couple of drivers on at some level of part-time on-call status to keep up with the need. So that would be included in this request for funds.
And I think I asked you before, but you try to coordinate your drives out of town with appointments for various clients.
Yes, ma'am.
You're not just
Yeah.
catering to one person, one drive.
Right. Yeah. If we can double up, we definitely try to. We don't require, a 48-hour or 24-hour notice for any of our appointments. We just let people know that they may not be available based on our volunteers or our vehicle availability. However, if we can get that lead time, a good 2 or 3 days, or at least a week, even on the out of towns, we can try and coerce that to try and put more than one person in the vehicle. And been okay successful at that. Everybody kind of gets their appointment set first and then looks on how to get there. And so we're trying to massage that culture a little bit on top of educate a little bit more on, trying to let us help them kind of make that plan a little bit better. But
Okay.
Yeah.
And on an average basis, how many trips do you make per week or per even month out of town?
out of town, on average, it's at least 3 a week. Yeah. And primarily that's only Cheyenne, Fort Collins, and Loveland. We've had a couple of instances where there's been a little bit more extenuating circumstances that we've gone a little bit farther, but that's about as far as we've.
You don't go up to Casper?
No, it's just a little bit outside the window of, especially if it's a volunteer, asking them to take that much time. We have a couple of people that we serve in Hannah, but it is primarily, and most specifically, it's like UC Health and Fort Collins or Cheyenne Regional Medical, those kind of things. So yeah,
Thank you.
you bet.
Anything else, Tim?
Yeah.
Tim, I was in a different part of this line of work, and one of the best things we did was publishing our calendar online. So it said, hey, we're going, it was in the flight business, so we're flying to Sheridan on Monday. If you have something in that direction, can you piggyback? Because we wanted to have full planes, as you can imagine.
Sure.
Is that something that is capacity that something you'd like to have, but you don't have the human resources to make that happen?
It would be great to be able to dictate that much. We don't at this point set a window that says, hey, we're on our way to Cheyenne. We don't do that without some kind of request already. And as we look to 2 or 3 weeks ahead on our calendar, everything can be booked through our website, the transportation or meal delivery type of things. And so as we look ahead, we try and force those a little bit, but we've not probably yet reached the structure to probably say that that's a guarantee, nor in all honesty, I don't know that our culture that needs this kind of transportation is not that proactive.
Yeah.
It's very reactive. Most of them try to exhaust a lot of other resources, find out about our services maybe as a little bit of a last minute even. And so a lot of times it's an appointment that's already been set. It's within a couple of days. And so I think we're going to get there. I think the more we're able to educate and also put that, I think it's a great idea. And I think it would be a great structure to have. I think there'll be a lot of education with our partners. So like with Ivanson on discharge or Live Health with appointments or Albany County, especially on the medical side. The lifestyle side, we could do that a little bit more, like if it was more of a, appointments that are for, lifestyle issues, whether that's utility payments or shopping or things like that, we could probably get into something like that. But no, it's a great idea. So I appreciate that.
Yeah. Anything else? And then, Tim, you have premium pay.
Yeah, that's pretty straightforward. Appreciate the commission letting us know that was something the nonprofits could go after, and we're working on that. We just have myself as the one full-time and one part-time employee, and so we've got those numbers, and appreciate Bailey working with us on that, helping us understand that formula. She was able to reach out to us ahead of time so that we understood that was kind of the path that the commission was headed on for that formula. So we'll massage those numbers and move on through. So.
Thanks, Tim. I appreciate it.
Right.
I'm going to get that podium up. It looks like it's my hands are holding on to your stuff.
Sure.
And I can't imagine you be the only one that has that problem.
We do have our other one going. That one there.
All right. Thank you, Tim. Appreciate it.
We do have our other one that's a couple more down the line. You want us to go ahead and attack that?
Yeah, let's do that.
If you flip the page, you'll see that our second request is mobile home park resource centers. And as we approach this and address this in the previous meeting, this is a pioneering project that we want to be sure there are some levels of it that may have similarity to some other proposals that we are collaborating with on resource centers for particular parts of the community. There is a couple things out there that we are collaborating with as far as some temporary transit housing, this kind of thing. This particular proposal is not one of those. It is specifically considered to be resource centers within Laramie's community mobile home parks. The request we have made is for 3 pilot locations. Primarily the first one that we've already begun collaboration with is Sunny Meadows over off of McHugh Street. And the intent here, and as the details say, is to rent, potentially eventually own single occupancy mobile home in each of our mobile home parks. At this point, targeting 3 pilots. These units would serve as an on-site resource center for the entire community. Each unit be staffed and have public open hours and programs, which include, but not limited to, a computer lab, teaching kitchen, fenced-in playground, study room, day center, safe place, community meals, and agency appointments. To clarify, that would be a place that agencies could bring their employees to a caseworker, case management, localized to the mobile home area. We are looking at this project as an ongoing, so this is initial funding to help us move forward in that. We believe that some of the programs would be incredibly sustainable based on just the lack of access that a lot of people have to these resources outside of those communities. I want to clarify and disclaim that we don't assume that everyone that lives in a mobile home park is unable to have these needs met. We just find that on some level of a more consistent level that there is these needs that recognize themselves, that are recognized in those settings. We also would dedicate transportation to each of these resource centers so that access could be made if services can't be rendered there. We feel this is applicable to the ARPA funds for the assistance to unemployed workers, for providing healthy childhood environments, assistance to households, and the disproportionately impacted populations and communities. So rather lofty and hefty endeavor. We believe it is one that would have a very distinct impact on our mobile home communities to have a resource center different from the community center. This is not the swimming pool or the crafts room, but it could be a food pantry that was an extension of Interfaith. It could be hot meals and an extension of soup kitchen. Definitely could be, like we said, teaching lab, teaching kitchen, a safe place, especially as we know that we don't have a lot of access for a day center for children or students after school, these kinds of things. So I could go on and on. We're very passionate about this project, but would be open for any questions or clarification that you have on this proposal.
Sue, any questions?
Yeah, to begin with, you explained all the services you would be providing and the need for those, that those would be sustainable. But financially, how would this be sustainable?
Right, I appreciate that question. So I think our intent moving forward would be to find corporate sponsors that would come alongside. Our organization as a whole is funded completely by donation and grants. We believe that these services would be applicable through grant application, even through things like Wyoming Community Foundation, continued county funds, and to the private sector. The services would be offered for free.
Okay, and I don't know about the feasibility of having a mobile unit in every single mobile park. Could you see yourself having one place centralized, not necessarily in any particular mobile home park, where you could serve all the various individuals who do live in mobile home parks that could come?
Sure. And once again, just to kind of reiterate that we're not making any kind of assumption about individuals or families that live in mobile home parks. We recognize that, the needs are all over the place. What we have noticed in the last year and a half or so, the services that we've been providing, especially through transportation and meal delivery, is that there are some consistent factors that have to do with geographical limitations of getting services, to those communities, and sometimes maybe not even services that they recognize. For example, one of the biggest things, and I won't mention a particular park, but particular times of day, the children are just running everywhere. And even though they might have a community center, not taking advantage of it, we're not saying that it's a, like officially licensed daycare, but a safe place. So to answer your question, I think we could definitely envision individual static sites that maybe serve multiple locations geographically. I don't know that one particular location just in one part of town would completely meet the goal or meet the need. I do know that through collaboration that are some of the other projects, I do believe that type of site is in conversation that I think would be a lot more conducive to multiple agencies meeting together. The intent behind this proposal is much more localized about a neighborhood and trying to find services. So for example, if it was something, let's use Sunny Meadows for an example, that would be a very easy one to service both Sunny Meadows and the Timbers, and maybe even Lee's RV park a little bit closer in that. But transportation would still be an issue that we feel like would be pivotal to include there. So I appreciate that question.
Okay, thank you.
Yep.
Anything else, Sue?
No, thank you.
Yeah, my question entirely, Tim. I think it's a great idea. I worry about the sustainability after this money is gone. But we're thinking along those lines. I think it's accounting money too. Having maybe a co-located community resource center
Sure.
in a new public health facility, if that were to be something that we are able to build. I think that's something from this group, from your needs that we could move towards. And I think the governor put out a letter on Friday talking about the need for these resource centers throughout Wyoming, and maybe there'll be some state ARPA funding that would help us build or supply this stuff. So thank you for thinking.
I appreciate it. Didn't mean to take up so much time, but appreciate
No,
that.
not at all.
Not at all.
Thank you guys.
Thanks, Tim.
Pete, can I just,
Sure.
Actually, we actually have somebody from Governor's Task Force.
Yes,
right,
we have 2 individuals from the governor's task
to
force.
talk about those resource centers.
Oh,
If you have
super.
a minute.
Sure, let's do that.
And Evelyn can fill us in real quick and then jump to them.
Bailey and I were just kind of talking about some of the efforts put together. We sent an email out to Cole and Josh also about some possible collaboration efforts. And so just so that we can have a better understanding, we have Sabrina Lang, the executive director from Wyoming 211, who is on this task force. In addition to Tracy, and Tracy, I apologize if I butcher your last name, Ronis.
It's Brocious.
Brocious, thank you so much. Who can speak more to what they're doing on that task force.
Awesome. Well, thank you guys for joining us, and whoever would like to speak, why don't you just go ahead and we'll just follow up with the next person.
Well, I'll get started. Thank you. I'm Tracy Brocious. I'm currently the CEO in Cheyenne for HealthWorks, which is a federally qualified health center. But prior to that, I was with the hospital, and that's where I started my work with the task force. So I've actually been leading. Can you hear me okay?
We got you loud and clear. Thank you, Tracy.
Okay, good. I've been on the task force. The task force has been working for the last, surprisingly, 2.5 years now. We started with convening a large group of people statewide in the healthcare arena. Hospitals, nursing homes, senior centers, obviously social services. 211 has been on there. So we convened a very large group of people in order to kind of tackle the governor's question, which was, how do we reduce the cost of healthcare in Wyoming? So that is a very large question. So the way we tackled it to begin with is we broke into and kind of prioritized and did 4 separate kind of work groups of things that we thought we could put on the ground that would have impact. And the group that I led was on the aging communities. And in that committee, along with one of the parallel committees under the social determinants of health, we kind of arrived at the same kind of idea, if you want to put it that way, which was this concept of resource centers. Now, we are still at the kind of very high level concept of resource centers, not necessarily all the way down to how it would actually look in each community. But what we identified is that resource centers, people need places to go, right? When they are not just in crisis, but in the healthcare arena, right? We want to engage people before they actually need healthcare. We want to engage families before they get to crisis. We want to talk to seniors and their caregivers before they have to make those really hard decisions about, what do we do with mom, right? Like, do we need a nursing home? So we're trying to back up farther up the stream of conversations. And sometimes people are not engaged and don't even know where to go. And one of the things that Wyoming has lacked is what's called a no wrong door kind of agency. Now, 211 has been very much kind of facilitating that conversation up to this point, and it has been statewide and used by multiple state agencies, and obviously is probably well embedded in your community also. So what we wanted to do is build off of things that we already have, but then also figure out what could we do to kind of facilitate that. So what made it to the strike team and through the multiple layers of decisions that came out in the governor's proposal for the first $500 million. Now, and I know that this is also ARPA funding. And I'm sure there's lots. So it's a great time, unfortunately, because of the pandemic, right? There's lots of money falling from the sky, but it's also got strings attached. And so the $1 billion that the state received, the governor kind of put out through the policy, the process. But since we already had the task force was already in place and already kind of moving prior to that, the $1 billion being kind of earmarked for the state. So anything on the health and human services side kind of went through the task force, and we kind of vetted things. Our focus was, what could we actually do, right, in the time frame that it would take to actually build the funding. So the items that are in there are very deliberate. And so Sabrina, I'm going to jump in and just kind of talk about how your funding and our funding are kind of commingled. So the group really felt it was important to ensure that we try, right, because this is, we knew that at some point this was going to have to go through the state legislature. And you are asking all the same questions that we're prepared to answer, which is, what are you going to do with the funding? How do you know it's going to be effective? How are you going to sustain it if you build something with it? And, you know, not just about now, but, you know, ongoing into the future. So with that in mind, what we proposed and put forward were two proposals. One, to build the infrastructure for 211, because while 211 has been kind of that intake and then handoff, right? It's been kind of one direction, right? So people call in, we have this great database, we refer them out, but we don't have that kind of loop back function, right? In order to make sure that people get what they needed and actually get there, right? One of the things that the group in general, the whole task force recognizes is that it's complicated, right? It's really difficult to navigate some of these systems. So our proposal was to add staffing to essentially do, and I don't like to use the word case management because that means different things in every environment. So what we're proposing is more or less a network of champions, of people, because really this is high touch type of things, is to connect people who may have something as easy as just a basic question of where do I go, to, okay, now I know where to go, but I don't know what to do, right? So we're proposing staffing, not brick and mortar. So I appreciate the fact that Albany County could potentially be already looking at how do we house this, because that's great, but every county is going to do it differently. And so what we wanted to focus on was making sure that there is a body in order to cover the state. Now, what we also wanted to do at the time was we wanted to make sure that our ask was reasonable. So we used the kind of the basic framework of the 9 judicial districts in Wyoming as kind of a number to kind of shoot for. So we shot for a social worker level type of position, right? Somebody who is trained higher level than just a kind of an intake person that could help families navigate. So the funding that we've requested is about, I'm going to say 14 bodies, if you want to put it that way, to and we're still in development as to where and how and what these folks will be actually asked and tasked to do. We wanted to make sure we were going to get the funding before we put too much more effort in this. So it looks very good that it made the first cut. We have to get this funding now through the legislature because all of this funding is subject to joint appropriations and a full, it's going to go through kind of a parallel budget process during the state legislature session in February. So what we're proposing is those bodies would either be on site across the state and or virtual. So and what we are really focusing on, I want to back up just a little bit, is that we know we have multi-generational families. So in other states, there's a lot of great work around family resource centers. And there's also a lot of great work on aging and disability resource centers. So what we recognized is that in Wyoming, we're small, but huge as far as statewide, right? And we need to make sure that we've got resources that are specialized if you have a family who calls in with an aging adult versus a family who calls in and says, hey, I need some potentially some parenting type of things. But we don't have necessarily enough to build both types of resource centers in every community. So what we're proposing is more of a virtual and or potentially resources to supplement existing champions in communities. So how this may look like is that we will have a host organization that is responsible for this type of model. But then if, say, Albany County, I'm guessing kind of the direction that you may be going, which is you'll have a brick and mortar with some staffing, but maybe it would be an additional, say, half-time funding for an additional somebody. But we will have a model that we're working with the UW on of a fidelity model to try and put some bones around this and some qualitative metrics. So that we can prove that this resource center concept actually works, because at the end of 3 years, then that gives us the kind of the bones around showing that it is something that the state and or the state agencies or funders, et cetera, should continue to fund because of the outcomes. And that we can show that it works across the state consistently, rather than in a really fragmented way. So I just wanted to kind of let you know that that's what that $4 million is it's 3 years of funding for this team of 14-ish people, plus the money that Sabrina has that we kind of carved out for 211 would also facilitate some additional staffing for her. And also what we're looking at is a technological platform that could help all of the communities link each other together in a way that we could link resources. Because we may have somebody, say in Laramie County, that is a whiz at getting folks on community choice waiver applications for seniors. And they can take a caseload, but they may not have a whole caseload in Laramie County. So how do we leverage those dollars to the best of our ability to get as many resources in as many communities as possible? So I know that's a lot, and there's still a lot in development because it's complicated, because that may look different in every community, and we're trying to make sure that we accommodate that. But at the same time, trying to figure out how we use these dollars to really help and get to those folks that need help but maybe aren't yet connected someplace. So I'll let Sabrina jump in and fill in whatever else that she had, and then we can take a few questions.
Tracy, I think you captured everything from the health task force perspective, and I appreciate your time this morning. I don't really have anything else to add related to this resource center, other than 211 is fully committed to making sure that that we're here available as a continued resource and being able to provide the resources that are within our database to support each of the counties, as well as the resource center conversation that Tracy just shared today. So thank you, Tracy.
Thanks, Tracy. Thanks, Sabrina. Commissioner Barra. Anything?
Yeah, thank you.
So Tracy, I guess this question probably difficult for you to answer, but we are considering a brick and mortar, like you thought of, resource center, maybe co-locating it in a county facility. Would there be many available for that, or just for the staffing? And is there pilot programs that you guys are envisioning for communities like ours that are really low income, low resourced with a high need, that might be the most useful place to start the money?
So there's no money in there for brick and mortar. I'll just put that out there. So I would encourage you, if you're thinking brick and mortar, and one of the reasons we opted not to ask for brick and mortar was because the legislature gets a little concerned about investing in brick and mortar prior to a pilot actually proving that it's worthwhile. So that's one of the reasons that we opted not to ask for brick and mortar. We wanted to make sure that we had a good foundation for the activity, right? And it potentially makes no sense in some communities where they already have existing brick and mortar. So we wanted to make sure that we leverage. So for example, for the senior centers, there are senior centers distributed across the state that do great work. But they may not have enough bandwidth to do the counseling that families need, from the time, earlier on. So what we would be doing is potentially supplementing the staff in an existing brick and mortar. And so and in Laramie or in Albany County, if you guys are looking at, okay, we're going to take some of our county dollars and build brick and mortar, this would be a supplement potentially for, and like we said, we haven't quite worked our way through the details of how that money would roll out to the various spots, but it'll be actually more staffing dollars, which in some ways is sometimes harder to grab onto because sometimes you can repurpose space, but staffing usually comes down to you don't have enough bodies. So that's kind of where we're headed. So I would really encourage, and I know we already have some folks on the task force from Albany County, but if there's anybody from this group that wants to join that, we're going to be starting having more robust conversations about what the resource center looks like, because we'll have to have that put together for the legislature.
And then Tracy, at the 14 staffing, are those people are you going to try to make the social work disciplines around them? So like medical social work is much different than I don't know, housing social work. Are you figuring that you would have a few of each and then maybe telecommute or telehealth those people around the state? Is that your thoughts?
Yeah, that's and what we at this point, then we're going to start to lean in on those folks that already do that and figure out what it is, where the need is. Sabrina has some data based on the number of phone calls and kind of categories. So we're gonna dive into that data so that we know we definitely need to have more weight over here based on historical issues over here. Really, the people that we're trying to scoop up are ones who are not, and we're not trying to create anything to replace anything. These are definitely supposed to be in addition to. So those social workers that already sit in, say, the Department of Family Services, or all of those folks that already sit in those places, this would just be another layer in order to maybe connect them to get these people connected onto those. So one of the most basic conversations that we've had is that we recognize there are a whole bunch of kids in the school districts that don't do the free and reduced lunch program because they don't trust, right? They've had a bad experience with the school. They don't understand the paperwork, and therefore then the school doesn't get all the funding. What we're proposing potentially is that there would be somebody in a community that's not related to anybody, right? That there could be somebody who could help facilitate that, or SNAP applications, which are incredibly difficult. They don't need to be difficult, but they are difficult because of our technology. So those extra set of hands to help do those things, to get those folks just that additional lift. But your point about the most vulnerable is right on. Wyoming has an issue though, because some people don't think that they're vulnerable, right? They don't feel that they're in that category, but really they could do with that additional assist. So going to a DFS office is overwhelming, but maybe coming to some place that's not associated with any of those places may still be able to connect them and help them with the application. So that's kind of our concept. And if it works with this funding, what our hope was is that it would only build from here. Because we're talking about $1.6 million a year in order to fund this piece. If the state were to come up with, funding going forward, we could double that size for actually a very low amount of ongoing expense. We just have to show that the model actually will be effective. So I
Thank you,
hope that I know
Tracy.
that's a lot, but it's moving. So I would really encourage somebody from Albany County to participate so that you guys are in on the conversation as it moves forward.
Okay, and I just put it a plug in. I run a free clinic where 20% of the folks speak Spanish only. And so if we had that ability, that's a growing population, it seems to me, in my tenure at the free clinic. And so, just to let you. Anything else, Sue?
No, you just addressed that. Tracy, I was going to ask if in your discussions with vulnerable populations that you have considered the language barriers, and not just Spanish. There's Chinese that's pretty prevalent as well, at least here in Laramie.
Yeah, absolutely. And the beauty of doing this and pairing it with 211 is that there's already infrastructure built there to help with that, right? So this is really meant to be an assist on top of and not to replace.
Well, thank you for taking your time, Tracy and Sabrina, and for helping us out. This looks like to be a pretty interesting synergy here. Maybe if we can get you guys funded and us a resource center, maybe that might be a really interesting place to start. I look forward to it. Thank you. All right.
Great. Thank you.
Thanks, guys. Next up, Hospice. Jessica, are you on? I believe you are. No, you're not.
Yes, I just had to find my mute button.
Okay, you got it. Could you just give us a little bit of your request?
Yeah, I think I really went over everything in the last request, and I can touch on those things again. And I've made a few changes since then. But really, our struggle is our cost of doing business has increased significantly with increased PPE. And what we have found is that more people than ever are requesting charity care. And we have a policy of not denying inpatient care to anyone based on financial reasons. But that has been tougher and tougher this year as people are working multiple jobs and they're not able to care for their family members at home, so therefore need the inpatient facility, or they aren't working and can't afford the inpatient facility. So we found many ways to offset those costs with different grants and things like that for PPE and for charity care. But our other big struggle is staffing. So our request is for premium pay for essential workers. And we do take care of people on hospice that are COVID positive during their final days of life. And I think definitely qualify as essential workers. And what I've changed since the last time is how we would spend the money more as a bonus rather than a payroll expense that would be unsustainable. So the $75,000 would allow us to provide bonuses of between $300 and $700 to all of our staff for approximately 18 months. And I'm happy to answer any questions.
Sure. Jessica, I think that I'm not sure we figured for the county $200 a month from April of 2020 through the end of June of 2021 for a full-time employee. And then if you had part-time employees, half-time would get half of that. A quarter would get a quarter of that. That's kind of how we figured it out for the county. It seems like this is this for 18 months? What are your 18 months? Where do they begin and where do they end?
Well, it's hard to tell where they begin because we don't know when we would get the money. And this would just be for clinical employees who are dealing, on the front lines with patients. And depending on what amount we were awarded, if it was the full amount or something less, that would kind of depend on what the bonuses would be and then how long it would last.
is there a way that you could figure out from April of 20 to June of 2021? If all those people that are still employed at $200 a month per full-time, and then prorated for part-time. Is there a way you could figure out that number for us? Hopefully easily.
Yeah, absolutely. That's easy.
Sue, any questions?
Yeah, Jessica, first you said 300 to 700 for all staff, and then you said for clinical employees.
Yeah, for all of our clinical staff. I'm sorry for the confusion.
Clinical staff, okay, not any other employees.
Correct. And the big thing is, we have a hard time competing with the hospital and other for-profit organizations for really good staff. We don't have a bottomless pockets, as it seems that many other places do. And the cost to attract and retain really good quality clinical staff is pretty enormous right now.
Yeah, and I know you know this, but just to let you know, if you don't, this is one-time funding, and that is not something that we'll be able to continue to kick in, I don't believe, as a county, unless something happens differently in our county resource budgets. But yeah, anything else, Sue? Thank you, Jessica. I appreciate it.
Thank you.
Up I have Laramie Salvation Army. Would you guys like to speak? I know you don't have anything requested, but if you'd like to speak, great. And if you wouldn't, that's fine too. Okay. Don't see anybody from Salvation Army. The Open School. Is anybody here representing the Open School? Open School. All right. Moving right along. Laramie Reproductive Health. Naomi, I know you're here.
Yes.
Good morning.
Good morning.
Go ahead whenever.
Okay, so our biggest request is for a mobile medical clinic. And the unit itself, we're hoping to get funded through the ARPA funding. But maintenance and staffing and everything, I'm hoping to get funded with Title 10. I submitted our next 5-year grant last Friday, and it included all the costs for the upkeep of the truck, staffing of the truck, and maintenance, those types of things. That 5-year grant cycle will start in April. So we should know in the next month or so about where our funding there lies. The desktop computers will complete upgrading of all of our computer systems. The rest of them were upgraded with Title 10 expansion funding. And the laptop computers will, they'll give us 1 more in the clinic, but then 2 of them are intended for use on the mobile medical unit itself. The centrifuge will allow us to expand lab services to be able to do blood draws, which we haven't done in the clinic for well over a decade. So it would be great to be able to expand our lab services, especially as we're looking at implementing HRT for a variety of our patients and PEP and PrEP. All of those require regular labs. It would be great for us to do at the clinic. And then the sensory faucets to help eliminate the spread of disease. And so that would be in the lab, the rest area, and the 2 exam rooms. And I'm happy to answer any questions.
Sue, any questions?
Yeah, Naomi, are you currently doing any telehealth?
Yeah, so we've been doing telehealth since spring of 2020. We need to move on to a permanent platform because I know that we're just in this this COVID approved platform to be using with our HIPAA compliant Zooms. But moving forward, we definitely want to make sure that we have a solid telehealth moving forward. It's really tricky because we can do certain things telehealth, right? But to really start anyone on birth control, they need a blood pressure. If it's somebody that's got an ailment, we really need to set eyes on them or set hands on them. And that's where the mobile medical unit really comes in. But as far as telehealth, we have been and we continue to do as much as we can telehealth, just also to keep the number of people down who are coming into the clinic if they don't have to come in. But we found that patients, they really like to come in. And some of them, it works for them to do it remotely, especially if they're, transportation is an issue, or it's difficult for them to get in between work. But again, there's sort of a select number of visits that we can do telehealth, and then the rest they just really need to come in. But we lead the state with telehealth for Title X clinics for sure. I've done me and Rob Johnston and Gail, who are head of Wyoming Health Council, we've been in a telehealth peer group since July. And so just working with other Title X clinics from around the country on telehealth. And we're really doing a fantastic job when we look at a comparison wide across the country.
To your knowledge, is there another mobile unit like this in the state?
Yeah, so there are 2 mobile units, not for Title X. There's no other mobile unit for Title X in the state, but there are 2 mobile units in Casper. The 12th Street Homeless Center, they got funding through the CARES Act for one. So they're doing mobile medical for their homeless population in Casper. And then there's also one other unit through the public health, I believe, that's running a mobile unit. We've been in collaboration with some folks down in Arizona in Pima County, and they do Title X strictly for their adolescents, and they serve all of the high schools in the Tucson area and throughout the county. And it's really remarkable what they're doing, and to be able to learn from them as a Title X specific mobile unit.
And so is that your intent with this mobile unit, or will you be trying to do primary care that you have been trying to do out of the brick and mortar?
Well, so our main focus is Title X. That's what we do, and that's what our scope is. But because of our patient population, some of them don't see a doctor or a physician otherwise. And so we would do their annual wellness exams. But if they needed something more like a blood pressure medication maintenance or something that was really strictly primary care, we do refer out for that so that we stay within our niche.
Thank you.
Yes.
Naomi, is your research that this would be mostly around Laramie, greater Laramie area, or are you thinking there would be much use in Centennial, Rock River, that type of stuff?
Yeah. So I wrote in the Title X plan that the first year we want to do 1 day a week. And that would be around Albany County and the Laramie area specifically, to see how that goes, to see, work out the kinks and so on and so forth that we'll end up having to do as we implement that. But even just like looking at being able to go to West Laramie, I think will be an important thing. So definitely being able to outstretch within Albany County, but Title X really wants to be able to expand to areas that aren't currently serviced by a Title X clinic. So that's the far eastern part of the state, the far western part of the state, Fremont County. And getting the logistics and the drive time to those locations, I think the eastern side might be feasible for sure, looking at those second and third years of having the truck. But if we're really going farther out, I think it's just a matter of, how are we going to pay staff to go 6 hours one way and then 6 hours back after a full day of work. So those things will have to get worked out, but definitely starting in Albany County.
So I'm guessing that you're thinking about going out to other counties?
The potential is definitely there, but again, we're a really small clinic. So for us to be able to do that, we're really going to have to make some major collaborations with staff who are in those areas, and really being able to also help pull the resources from the areas we're going to, setting up where the clinic is going to go. We're going to have strong connections so that we get there and we have a full day's worth of work, and we're not just going, for just a couple of patients. One of the mobile units in Casper, one thing that they said that they judge their success on is if they see the same number of patients in their mobile unit as they would have in the clinic with that amount of staff. And I thought that was a really great analogy, because otherwise they're pulling their staff out of their brick and mortar and they could be seeing more patients there. So being able to find that balance with staffing, I think will be important too.
But in that instance, they're not accommodating anybody outside of their community, outside the greater Casper area.
Right, right.
So, and you're intending to meet the needs of Rollins of Medicine Bow, because I know we have
Potentially,
clients
yeah.
that come.
Mhm. Yeah, potentially.
Would that necessarily mean that you have to drive all the way there, or could it be, because I, again, from experience, I know that we've had clients come from Rollins.
Yeah.
If you could coordinate more than one individual, have, let's say we have 3 clients that come from that area and 2 from Medicine Bow, could there be a place that they
Absolutely.
you park and they come to that?
Absolutely. Yeah, absolutely. Yeah, or doing like half days in Rollins and then up to Medbo for the other half day or something like that. Absolutely. Yeah.
Thank you.
Anything else?
No, thank you.
Thank you, Naomi. I appreciate it.
Thank you so much for your time.
You bet. Cathedral Home, supplemental assistance for youth and families. Who's up? Hi, Megan.
Hi, good morning. I'm Megan Rose with Cathedral Homes Community Programs. I'm the Community Partnership Coordinator, and I'm very grateful to be talking to you all today. I'll just start with, I guess, a synopsis of what our requests are. And if you have questions, I'd be happy to answer. Our supplemental assistance, we're really trying to focus just on supporting the families that are currently involved in our programs that we're already offering. So we're respectfully requesting about $20,000 to provide equity-focused supplemental assistance to support clients involved with our family care coordination, our independent living program, and our high-fidelity wraparound services. So these programs, our family care coordination and high-fidelity wraparound, they're family-led programs, and they're designed to support youth and families by connecting them to resources and coordinating effective change processes. What we're seeing with this demographic of families is they're already pretty financially vulnerable, but the pandemic has only intensified their struggles. And we're noticing more families who are coming to us who are lacking eligibility for social safety programs like SNAP, WEAP, ERAP even, or Medicaid, but are still living paycheck to paycheck, where some of these unexpected expenses are causing a lot of distress and serious setbacks. And what we're just hoping with this supplemental amount of money is that we can offer these folks, services for rent deposit, car repairs is a big one that we see. Families just get, compounding struggles, setbacks with urgent bills and other one-time necessities. And I actually have a recent interaction with a family I'm working with that just really illustrates what we're hoping to use this funding for. And why just this one-time amount of supplemental assistance, we really think will help build equity for these families that, we're seeing just bigger gaps with. So, for example, I have a single mom I'm working with in a wraparound process. She contracted COVID and her children did as well. So she's a single mom of 2, and she had to take time off for her job to not only take care of herself, but her kids, and didn't have sufficient sick leave to be able to pay her for that amount of time she needed to be home. And during one of our team meetings with her child, that we're all working on addressing some pretty significant behavioral struggles that are really being exacerbated by the family's stress level and financial instability during this time. One of the recommendations was just for the child to participate in gymnastics or soccer as an activity to support addressing behavioral, social, and some mental health needs. And mom shared just how financially depleted she is from such a setback of having to take so much time off due to COVID, and that she couldn't imagine being able to, afford to have her kid participate in that. So with this supplemental assistance, I would love to say, oh, we have that. We have that right now. We can just give you this $200 so your kid can have this access to crucial support and opportunities to help him really thrive. And so we're really just asking for this one time to help address these gaps we're starting to see, where these vulnerable families are becoming further vulnerable by the financial insecurity that they're facing in light of COVID. We're also hoping to use this funding for not just our families, but for our independent living program. So through this program, we serve 14 to 21-year-olds who, may not have a family support system that's helping them build skills to prepare successfully for adulthood. So we focus on supporting these youth in individualized one-on-one skill building, where we're helping them develop skills focused on self-esteem, healthy relationship, financial stability, pursuing post-secondary education, housing and career development. And again, many of these youth that we're serving, even though our services are free, they still need and have financial struggles to be able to pay for things like college application fees, clothing interviews, ID payments, and things like that. And so we, again, would just love this supplemental assistant to provide these therapeutic needs for folks involved in these services. Even gym memberships, these pro-social activities that really help with mental well-being. And we would just love to be able to have this pot of money to pay for these services. Currently, at any given month for all of the services, we serve about 70 to 90 folks. And within these 3 programs that we would be hoping to have this supplemental assistance, we provide it for about 30 folks currently. And we're just seeing it exploding in terms of the need and how many referrals and folks are providing, needing provision of these services. So we would just love to be able to partner with our community and provide these kind of therapeutic imminent needs to address these economic disparities.
Thanks, Megan. Commissioner Fair.
Thank you.
Yes. And Megan, do just the story of the mom, do they know that the COVID-19 vaccines are available? And that those are, that is.
Yes. So the mom and the children were fully vaccinated, but still got sick. Mom is a CNA and home health professional, so couldn't work her role, work as someone who contracted it. And then still her sons, even though they are vaccinated, came down with symptoms and couldn't be in school. So yes, we are definitely promoting the vaccine clinics for our families.
Thank you. I don't have any other questions. And this would be for the 3 or 4 years, 20. That would cover it for you, Megan.
Yeah, we just see this, as a short-term program where, as Cathedral Home Community Programs, we have, multiple grant sources that allow us to provide these services with sustainability. And so we anticipate always having the services themselves, and we just see that there's this big gap with the current situation with COVID, where the supplemental amount would be really helpful for the next 2-3 years to help address these inequities that we're seeing our families face. So in terms of sustainability, with just we just have been running these programs without this money already, and just see that it could provide address these inequities right now. So yeah, just for the next couple of years.
Thank you, Megan. I appreciate it.
Yeah.
Next up, Laramie Soup Kitchen. I'm guessing that's Ted. Ted, good morning.
Morning. There you go. Can you hear me?
Gotcha. Loud and clear.
Wonderful. Thank you so much for the opportunity to speak about our request again. We haven't really changed anything since the last time we spoke, other than I have been computing the math for premium pay over the first part of the meeting. And I think the one thing that I wanted to mention, and I understand that if this isn't something that you're going to be interested in changing, is that for us, we've actually been increasing our pay for employees incrementally over the last, the last 18 months or so, the full pandemic. We just discovered that what we were paying was not reasonable for our part-time employees. And so we've been making the commitment to them to increase it. To give you a sense, the $200 per month, so for a part-time employee, that drops it, that's prorated or equals out to $1.25 per hour. Over the last 18 months, we've given most of our part-timers $4 increase per hour. And so while I understand that the math is easy to do it by $200 a month or $1.25 per hour, it doesn't really help the organizations that, for various reasons have had to keep our pay rates a little bit lower. And because $1.25 extra for a person who is already making a very reasonable hourly rate is a great bonus. But $1.25 for a person who's not making a reasonable wage. And I think that's just a challenge. I mean, I'm trying to listen to myself as well here is that the easiest way to keep our costs low is personnel costs. And we try not to do that. We really do try to create the best possible pay rates for our employees. And we really spent an enormous amount of time before we approved the most recent budget to really try to focus on part-time employees and what we can do to better support them. So all that to say that the only other idea that I could come up with is that it says we wouldn't apply to full-time employees, but maybe what can be done, because it was the conversation that nonprofit world is a bit different than for-profit world, but something to do with if an employee of a nonprofit, let's say, makes less than $12 an hour, that for any hour worked under those $12 an hour, they would be given premium pay to bring them to $12 an hour. Once again, it'd be looked at as a premium pay. I think a couple of people mentioned this, and not necessarily an ongoing commitment. Although I think it would help organizations bring their employees to a minimum of $12 an hour through this support, through these federal funds. I think it just kind of goes into the piece about like whether or not minimum wages are high enough and things like that. To give an example is that before the pandemic, we were paying our staff $8.50, which is not, if you think about it now, very much money. We only hire students because we know that our pay cannot support a person who's wanting to look at it as a full-time job. And so that's why we do hire students. Because they have a little bit more flexible in their budget. And the highest paid employee before the pandemic was making 10 of the part-timers. And she was very happy with $10 an hour. And this was before the pandemic and before things really started to get hard. So just an idea of maybe there's a way to be a little bit more equitable in the approach instead of being equal in the approach. If you do stick with the $1.25 per hour and the $200 per month, it does reduce our request by $62,000. So, there's a lot of flexibility that we can look at with the full-timers. I'm willing to, I'm not too concerned about the full-time employees. We know that we pay our full-timers well, justly, I believe. But this is a significant reduction for our part-timers. And we were really hopeful that this premium pay would indeed be premium and allow us to really support the efforts that they've put in over the last 18 plus months. Other than that, just a couple of clarifying questions, which is the premium pay going to extend into the current fiscal year? We use the July to June fiscal year. So does it apply to this current fiscal year, or is it only going to be the retroactive going through June 30th of 2021? Because that would also further reduce our request if there would be no funding available going forward. And then the only other really quick question is, can funding be used to reimburse organizations for purchases that they've made, necessary purchases that they just had to make? So for example, we're talking in this case of the tables and chairs. We bought enough of them to kind of see what they look like in our space, to get an idea to make sure that they are going to work for when we reopen. But that was $2,700 that we spent in the hopes that it would generate a funding source, someone who would step forward and be willing to pay the other $6,000 to buy all the tables and chairs that we do need. And that was just a question as whether or not, because I did write it into our request of the $2,700, but if that's not permissible, then we can pull that out. So those are just some of my thoughts and questions.
Commissioner Vera.
I'd like Bailey to address those questions that he had as far as premium pay going into 2022 and if reimbursement is covered. Please, Bailey.
Of course. As long as regarding the tables and chairs for the $2,700, as long as they were purchased after March 3rd, 2021, they are eligible.
Okay. They're purchased in July, so that works.
You're good. As for the premium pay going into this fiscal year, that is actually up to the commissioners. What they did with the county was through June 2021. So it is up to the commissioners to decide if they want to continue that or not. This funding has to be obligated by the end of 2024 and has to be spent by end of 2026. That is something that the commissioners will have to decide if they want to do. But at this point, I think my understanding what the commissioners are thinking is just the April 1, 2020 to June 30th, 2021.
So in that case, under the new calculations of the $200 per month, it would further reduce our request by $8,800.
How much, Ted? I didn't hear that.
Sorry, $8,800. My original calculations, it actually reduces it by $53,000.
Maybe in your understanding, is there any relief for like part-time employees? I mean, that was the way we did it at the county, but did they describe premium pay? I can't remember reading that.
Premium pay is pretty much spelled out in the interim final rule. One of the biggest requirements is that you can pay an employee up to $13 an hour in addition with this ARPA funding. There is not anything spelled out specifically that I've read specifically for part-time versus full-time. It doesn't say anything about that. It does go into if your premium pay would increase a worker's total pay over 150% of their residing state's average annual wage, that gets to be more complicated.
I can't imagine that's going to be a problem in the nonprofit sector, unfortunately. Did you hear that, Ted?
Yes, yeah, that's and I just actually had picked out the $12 an hour as an example, so it's good to know that that's actually still under what the federal government. I would recommend that the commissioners consider doing additional pay, because it's interesting because the original fact sheet, I haven't seen anything since the original, but the original fact sheet mentions retroactive pay specifically, but that was after the sentence about currently paying premium pay. So if there is flexibility there to extend into the current fiscal year, even if it's only the current calendar year, that still helps.
And of course, that reduces the overall amount we can spend on projects with premium pay, and that is a decision that's neither here nor there, but just to let you know that if it was to be put out there for another year or two, then that means less money to be spent on projects. But you know that, so.
Right. No, I understand, Commissioner Gosar. You have some difficult decisions to make, and you're right. Projects are so critical. I'm kind of hesitant to give you this suggestion, but one idea would be that premium pay is not eligible for full-time employees, only part-times. But another question would be, I forgot about this earlier one, is clarification again on the payroll taxes. I know that you mentioned something about that at the beginning is the federal funds, can they be used to pay the 12% portion of payroll taxes from the organization, or does that have to come out of our own budgets? I only ask because some of us are running budgets that are so close that to pay retroactive pay to our employees without having the payroll taxes covered could be burdensome.
They can be covered by those funds. So if you were to, for example, if you were to give one of your employees $1,200, the taxes can come out of that 1,200. So into their pocket, it wouldn't be the full 1,200. It would be less for the taxes.
Okay. I did it slightly differently, which is I added the 12% on top of it so that it's an even number that would go to the employee.
Yeah. Okay.
I think that's right.
Commissioner Rivera. Okay. Ted, thank you. Unless you have something else you'd like to talk about. Thank you for thinking about this.
Yeah.
And as you can imagine, we'll have to make that determination outside of a work session with regard to the pay. And it's probably something we probably should think about sooner rather than later, so that we have a sideboard on what we would have for pay, and then we would know what we have for projects. So thanks, Ted. Appreciate it.
Thank you.
Climb Wyoming, helping single mother families during the pandemic. Bonnie, good morning.
Hi, how are you? I'm Bonnie Self, and I'm with Climb Wyoming, and I'm so sorry that Tess couldn't be here today when the day changed, so my apologies. Just wanted to thank you so much for your support, along with all of the great organizations on this call. Climb Wyoming is really requesting $30,000 for 3 specific objectives that were in the final rule. As many of you know, single mother families have been really disproportionately affected by the pandemic, a lot because of job insecurity, as well as lack of resources, and also the challenges with childcare and school closures during the pandemic. So there's 3 areas we're asking for. The first is mental health treatment, beyond just single mothers, but this has been a mental health crisis too. And so we've kind of increased that. And what was really important to us as we moved to a hybrid model where the moms are training in person when needed, for example, for certified nursing assistant, they're also on a computer a lot, and we're using a hybrid model. So we've worked really hard to make sure that our therapeutic component of the program can also be brought into that kind of more Zoom world that we're all into. So this will help with some of that. We've been working with an organizational consultant as a PhD out of Denver to make sure that we can incorporate those models, and then also increasing our mental health support within our program. The second component is to accelerate rehiring of unemployed workers. There's quite a need in in Albany County for employees. A lot of employers have reached out to us, particularly in the medical fields, to help train participants. And so we've kept our program with the hybrid model. We've had to purchase computers for moms, as well as train them and make sure they have the appropriate technology. The charitable relief funding that Albany County provided, I think that was about a year ago, we use that for computers, but we're still in this world of hybrid training. So we are continuing to purchase laptops for all of our program participants. So the funding would help with us continuing our training. And we're also, one benefit of the hybrid model is we're reaching more rural participants, so that this would also help those people participate. And then the final objective is this kind of, we have a large amount of advocacy work, and it's increased during the pandemic. So assisting households, we don't necessarily provide the funding directly, but we're connected to people in great need. So connecting them to resources in the community as advocates, so that they can continue things like ERAP, someone mentioned the SNAP applications, making sure they're on SNAP, things like that have really increased. So we're providing more outreach where we used to really recruit people for the program. We're also doing a lot more outreach just to help single mother families, keeping them stable until maybe there's a time in their life when they can do the program. We obviously collaborate with a lot of organizations on this call too, and we'll continue to do that with this funding. And I'd love to see if you have any questions.
Thank you, Bonnie. Commissioner Rivera, excuse me.
Not quite yet. Go ahead.
Bonnie, with the computer purchase, what are we looking at? Like how many did you purchase last year? And then how many more are you additionally needing? Do you know that number?
Yeah, we purchase, we usually have between 10 or 12 women in each program. We do 2 programs a year in Laramie. They last about 6 months each. They're very intensive. And we do group programming because the group model is so important for that support system. So we purchase one, I'd say about 20 a year. They're about $650 each. So not exceptionally expensive. We make sure they have Zoom capability. The one nice thing about all of the practice on Zoom is a lot of our moms are getting interviewed on Zoom. So we do mock interviews on Zoom. We'll do, as I mentioned, individual and group therapy on Zoom. So we make sure that they're compatible and have the software they need to do the appropriate training.
So do your moms, is that part of graduation? They get the computer? Is that why there's a constant turnover in needing computers?
Yeah, we do not ask for them back. It's just, it doesn't really make sense. And we don't want them to kind of feel that responsibility. So we let them keep the computers. They also are very helpful for the families, as particularly when children were learning online. Now they're not doing so much, but we do not ask for the computers back.
Thank you, Bonnie. Commissioner Bear?
Yes, Bonnie, does your mental health treatment continue after graduation, or is it just for current participants of the program?
It continues for quite a bit of time through what's called the employment training process. So we will actually reimburse employers for hiring our moms, because those first 8 weeks are so critical. It's really still part of the training. We meet with the employer quite regularly, and the mental health components continue through that employer partner phase, where the moms are actually on the ground working, and the hope and the expectation is that'll turn into a full-time job after the 8 weeks. So they do continue beyond graduation through that phase. And then we also have a large graduate services component, which has also grown through the pandemic, where anyone can come back. Once you graduate CLIMB, you're always part of CLIMB. So anyone can come back at any time and utilize our graduate services. So if there really was a need for mental health counseling during that phase, they would also have access to that.
And are those individuals meeting with group therapy with new participants to CLIMB, or are they separated?
That's a great question. We have graduate lunches, so they often meet together. We don't tend to have the participants, because of that group model and them building their own relationships with each other. We don't tend to have graduates back, but one interesting thing is we often have graduates back to speak to new participants. And we've even had graduates hire new participants where they're working, or recent graduates. So we don't tend to intermix the group component in the current training with graduates, unless they're coming back to help, speak about their own experiences.
And then, Bonnie, these funds, 30K, is it just obviously temporary? It's a one-time ask. How is this sustainable for future laptops, future behavioral health treatment or mental health treatment and all?
Similar to, I think it was Cathedral Home. It's helping to fill a gap as we need to continue to get this hybrid model really work with our therapeutic programming. I'm not sure how long we'll be online. The hope is that the laptops and the hybrid model, in a couple of years, we get back to being in person, because that's still the best. And we also do have a wide variety of funders that we feel like, as we continue to get through this, what is hopefully a hump and not in perpetuity, we can then maintain our regular model back to the way it was. So we do have sustainable funding. So this is really trying to cover some of the increases in costs due to the pandemic.
Okay, thank you, Bonnie.
Yeah, thank you. Great questions.
Thanks, Bonnie. I appreciate it.
Thank you.
Next up, Laramie Interfaith. Josh, are you with us still?
Good morning, commissioners. Thank you. I'm Josh Watanabe with Laramie Interfaith. Also very happy that Tracy with the state was able to go before me. As she explained, they've been working on this for 2 years, and what you have in front of you is something that primarily Cole and myself have put together in a month. And so it kind of highlights maybe why there's not as much information as one would need to truly understand this. But what we've tried to do is I think take a little bit of a step down from where the state is at and talk specifically about what this looks like for our local nonprofits as a network working together in a brick and mortar, the reduced cost, that no wrong door approach that Tracy had mentioned. Where do people start? Frequently, we're here at Interfaith, we're seeing people that come in with something we know another agency in town addresses. We try to refer them over and send them, but you know, transportation we know is an issue in this town. There's also a sense of I need that now that I think that Tim had talked about, the sort of urgency of a situation, whether it's transportation or something else. And when we bounce them around somewhere else in town and say, well, try this place 20 blocks away, we're really putting a lot on them. And that's not the easiest way to go about that. When, you know, if we had this sort of brick and mortar, you know, we'd walk them across the hall and introduce them to somebody and sit down with them and make that handoff. You know, and really I'm just kind of echoing things that Tracy had said at the high level, that we have started to think through. You know, they talked about the need for case managers to really help get through the paperwork of all the processes, whether that's SNAP, whether that's WIC, getting a new Social Security card. These are things that Interfaith case managers already do. It's a part of our case management, something we help our clients with because those are barriers to getting into housing, getting jobs. So we're taking that approach, but we're also trying to unify the nonprofit community that, you know, we already have in this town, working so hard on addressing all of the many issues. You know, when people walk in, it's when she said, where do we house this? There's technology, but I think technology only goes so far with the demographic that we're talking about. 211 is a great resource, but we still have some level of barrier when we're working with clients. You know, they come into our door, they say, where can we get this? We call 211, and then there's still that transportation issue of being bounced and sent to another agency around town. One thing that they have talked about is, you know, this is to assist, not replace. This is the same thing that we're trying to talk about. Nonprofits need space. One of the people that we've had this conversation with, Salvation Army, they do a lot of work for our community. They don't have a space. They don't have a place right now to sit down with a client and go through their own paperwork. They're doing this over the phone, or they're doing this here at Interfaith. We're faxing it, emailing it, scanning it, whatever, over to them. So it really comes down to space. I know that there's a whole conversation around how this might be funded. And so, you know, I don't want to rehash everything that I think Tracy and Sabrina went through, but I'd be happy to talk about it and answer questions.
Should I bear anything? So Josh, there is a contemplation from the county of purchasing a building and designating some of that space for a resource center for nonprofits, either to rent to nonprofits or to just have available to nonprofits. And so could you talk to me about what that space might need to be requiring that space to be useful to what you and Cole have thought about? Cole, jump in whenever you'd like to too.
Yeah, I mean, I think, you know, this is a space, you know, people walk in and there's a front desk with a receptionist who has that ability to point someone to the right place. And if they get it wrong, you know, again, it's a place where we walk across the hall and we say, here's this place. Or if we're sitting with a client and going through their list of needs, and the first thing on their mind was housing, but, you know, maybe it's, they need help with something else, medical needs or mental health or whatever that is. When we discover those needs, we can address what we can, and then we can, quite literally walk them across the hall and have them sit down with someone from another agency and make that warm handoff in a welcoming place that is not so unhuman or disconnected from, here's what we can do now, go call this place, go make an appointment over here. It's, I think the idea behind this is really, when you walk in, how many nonprofits can we put there? Who wants to participate? I think there's a lot more conversation about what this would really look like in practice than we can, have effectively had in 30 days since we started this. I understand what we're asking for is a very big ask, and there's a lot of complications that need to go into this.
If I can just add, I think if we got everything right, 100% that we wanted, it would include probably space for vehicles, specifically, vehicles that can be used to transport people to other places. We'd like space where for transitional housing, for whether short-term or long-term. Those are just units, small units, not houses. Office space. Let me think. Like a community room, like a meeting room, right? Somewhere we can have a space for presentations and meetings and things like this. Do you have anything you'd add to that, Josh? I think that's kind of the big stuff.
Yeah, I think you've got it all kind of nailed down.
So if the transitional housing was separate from that, if the community space was 4 to 8 office areas, a conference room with, computers and phones and that type of equipment, is that something that could help meet this need at least partially? Because if it's a county building, you can obviously understand we probably don't have any place for people to stay at night.
Yeah, I mean, if it's a county building, there's things I don't understand or know about the county. I mean, we're trying to address, I think, a lot of needs with this proposal. And when we get into talking about how practical is this, there's things that are going to have to be lost. How we make that decision, I don't know. When we're talking about the transitional housing, right now we just had our the Wyoming Continuum of Care call this morning, and we've got close to 400 chronically homeless people in Wyoming that have a tie to Wyoming. These are people that end up bounced around between the counties. When they sort of run out of services in one place, they go to the next. They're not getting out of that cycle. And this is something that is central to Cole and I's mission specifically. But there's, I think I saw Brenda Burkle on the call, My Front Door. They work on getting people into permanent homes. We're certainly not the only ones addressing this and recognizing this as an issue. The problems of homelessness kind of compound on all of our other agencies. More healthcare is needed, more mental health care is needed, more food insecurity. There's a list of things, right, that just kind of snowball. So to cut that out is hard. Is it a technical need if we're looking at a space where the agencies can work on a no wrong door approach? One front door where we can all represent the other things that we can address. I don't know that any approach is wrong as long as we're doing something big. Can we create something that addresses every need we have? No, probably not. But we're certainly at least pitching that as a, a goal.
I'll jump on. I echo what Josh is saying. I think to just kind of directly address what you're asking, if we have a building that's office space, right, has space for example, we have a diaper pantry that we run out of a church right now. If that diaper pantry was directly connected to several other services, fantastic, right? We don't have to send people to UPC in order to get their diapers, their hygiene products, all of that is in one central location. If we have a place where Tim can leave a van so that we can get people around that way, fantastic. I think for me, just from our agency's perspective, and I know Josh has a similar perspective, whether you do it now or later, the community is going to need some sort of transitional housing. It just is. It's just the way it's going to be. And I just think it would be a shame to lose that element. But that's not to say that the proposal still wouldn't be valuable. The space is especially valuable. But this is a problem that's going to have to be addressed eventually. So I guess that's all I have to say about it.
It's cool. Thanks, Josh. Commissioner Rivera. Anything?
Yeah, so I know you're leaning very much towards wanting to have the transitional housing space included in your one-stop office. If you brought in some of these other nonprofit agencies that work with you into the office, do any of them have space that they could give up for the transitional housing currently, so that a building wouldn't have to be bought or built, where your services are all in one place? And by doing that, some nonprofit space they're using right now could be converted into the transitional housing.
Commissioner Ibarra, I think it's an interesting question, one that we've not explored too heavily. I know, for Interfaith here, our building will continue to be the pantry where we've got our warehouse going up here in the back. The physical amount of space that would have to be added on to what we're already talking about is a very large space to house these nonprofits might be prohibitive. It might not. I mean, we're talking about an imaginary space, and that could certainly be reconfigured into a housing option. If, in a perfect world, sure. I think we've, the primary agencies that we've at least had the chance to talk to here in the past couple of weeks. I know that Cole does not have housing. He's housed in the church right now where his offices are. Again, Salvation Army doesn't have any office space at all. We've talked to Tim with Laramie Connections. I know he's renting what was formerly a dentist office, I believe. And there's other businesses in that area. So with those that I'm most familiar with, it's not impossible, but I wouldn't say that it's highly likely. I think the Interfaith building is probably the only option at that point. But in this proposal where all the agencies are housed, I'm not necessarily considering relocating my 10 staff into one building. I would send a case manager over there to work with those other agencies, but not have 10 offices under my own.
Understood. Thanks, Joshua.
Thank you, guys. And then, Josh, I guess we'll just go down to the Laramie Interfaith Office remodel, the second part of it.
Right. I still had that one. And I had not gotten a whole lot more information over to you guys. I had spoke with Bailey and made sure that what we would actually be requesting would be allowable under the equipment side of things. And then I apologize, I spent more time on this other proposal than rather forgot about the other one mostly. So don't have anything to add to that other than I think that my number is probably high on that one. I don't remember what my original amount was.
Yeah, so I think you have 100,000 on this one.
Yeah, I think if I were to adjust and put together an application right now, I would lower that rather substantially. All we're talking about is equipment to go into the pantry that is currently under construction. Due to COVID and the rise in construction costs, we saw almost a full 100% increase in the price of our building. We moved forward and are committed to that project, as well as using the CDBG grant money that we received from the Business Council. Necessary cuts have been made, and we're still looking for funding to put the actual shelving and scales and the equipment into that space to make it fully usable.
Josh, Commissioner Barrett.
Thank you.
Josh, I think I read in the governor's proposal that there was, if it gets through the legislature, money to do just what you're suggesting with CDBG, because that is not, I guess, just your problem. I guess other CDBG issues have risen. And so I think that was in his letter to the JAC that I read. Now, whether it gets across the line or not, at least it's hopeful that it's in there. So
yeah,
just to let you know, if you weren't familiar, which you probably are.
We've been working with that, and Representative Sherwood has been excellent help to us on that. What we're less than clear of is how JAC will word that, and whether or not it will be something we can get reimbursed for now that we've already moved forward on the project.
Thanks, Josh. Appreciate it. All right, thanks, guys. Appreciate it. Next up, Cyber Wyoming Alliance. Yeah, Laura, good morning. Floor is yours.
Morning. How are you? Thank you for having me here today.
You bet.
So let me get this up. Just like we personally have to secure our bank accounts with good password hygiene, there are many things we can teach ourselves about securing our organizations. These are human issues, critical thinking issues, decisions that we make every day as employees and as managers. So we're proposing a training for Albany County nonprofits. Why nonprofits? Our communities depend on these nonprofits, and nonprofit security is a key to economic resiliency. But this training is different because it isn't a one and done. Instead, it's provided in a support group environment that nonprofits better understand, with lots of on-the-job learning opportunities, and with the ultimate goal to create mentors in the community that can help the entire community long-term. I think it's a Build Back Better program because most of these nonprofits are underserved by IT companies. IT companies often overlook nonprofits because the nonprofits are smaller and they're perceived to not have the budget for IT. Thus, they're not considered a profitable client for the for-profit IT company. Also, nonprofits can get their software licenses for free or cheap through multiple programs via Google, Microsoft, or TechSoup, which also cuts into the IT company profits as they resell licenses to their clients. And that license revenue is removed when they work with nonprofits. So truly, nonprofits have to teach themselves what they can do. And starting with the human is the best way to do it. So let me ask you this. I bet most of us believe that we are productive, self-motivated, agreeable, conscientious, and emotionally stable people. And these are the people that we want to hire and work with as well. But did you know that these are the riskier personality traits for being online? So the training starts with these human factors and how to address them. But it also starts out the training with an introspective discussion that feeds into collaboration later. Then the training will move on to relating security to the organization's mission and vision. And then the on-the-job part, where the organization is walked through a current situation analysis for security, and then how to mitigate those problems that are found, and how to write security policies to ensure that security is considered long-term at the organization. Finally, once the nonprofits have gone through the process themselves, they can begin to consult with their customers. For instance, Tim at Laramie Connections could talk about cell phone security when he picks his clients up, and how to secure their cell phones. And that makes the entire community safer. Security conversations and mentoring are the outcomes of this program. And I truly want to thank you for the opportunity to discuss it for a few minutes here. And I want to assure you that we've been doing this for 4 years statewide, but we have never totally focused on nonprofits. Our outcomes for these past 4 years are excellent. For instance, we asked the question, what is your overall level of confidence with the subject of cybersecurity at the beginning and the end of the process? And at the beginning, 60% say that they are nervous, neutral, or not at all confident. But at the end, no one is at that lower end of the spectrum. So I'd like to take any questions you might have.
So, Commissioner Barrow.
Yeah. Hi, Laura. It's good to see you. It's been a long time. Laura, so explain a little bit more about this process. Is it a one-time education? Is it several meetings? Is it through Zoom? Is it in person? Can you explain a little bit more specifics about the process?
We can do it through Zoom for sure, especially if the Omicron keeps going up. And it can be virtual for sure. It is an ongoing process. So it's probably either 8 months to a year, depending on what it is. We would meet routinely. We create cyber buddies. So 2 nonprofits might actually team up to do the work together. And it's more of a support group type of environment. So we would pick a topic, go through that topic, make sure that they feel competent, go back to the office, do their homework at the actual office, and then come back to the group and discuss what they found and how to mitigate it. So it builds that community of learning.
And so 5,000 doesn't seem all that much, Laura. How does that go? Where is that expense?
It's primarily for our time. And we've already been doing this for 4 years. So we figured if we group all the Albany County nonprofits together and don't do them individually, we can economize. And that's why it's not very much money. But the whole part of it is basically, since we have been doing this, we have pretty good time estimates of what it takes our staff to do this. And we have all the materials ready. We have the programs been in place for a long time. And we're just focusing now on walking the nonprofits through it in Albany County.
Thank you, Laura.
I don't have any questions. Thank you, Laura and Patrick. Bailey, I see it's in the green. It wasn't before.
Yeah, after a little more research, I believe it qualifies.
Okay.
I can still look into it a little bit more if you would like me to.
No, but if you feel.
I am more than welcome to double check things. This is money I don't want to mess up.
Right. Well, thank you, Laura. Thank you, Patrick. I appreciate it. All right. ARC Regional Services. Anybody from ARC?
Hello.
There we are. Hi, Colby. How are you?
Here from ARC Regional Services. Hello, and thank you for your time this morning. I will say, I believe some pieces of our request were addressed and clarified by Bailey earlier in this meeting. Very similar to some of the other organizations here. We are addressing a request in funding by means of premium pay for our essential workers, specifically our direct support professionals. If you know a little bit about the direct support professional position, we also call it a DSP. They offer support for the individuals we serve at our regional services in many areas, including direct face-to-face care, physical support, and hygiene supports. As you can imagine, these supports are not only kind of giving an increased health risk to our direct support professionals during COVID, but it also kind of increases risk for the people we serve as well. So we're kind of getting that double whammy there. Despite these challenges, our organization does not have the option to stop our services. We run 24/7, offering support and care. As we aim to provide these exceptional supports within our organization, staff retainment and hourly wages become a vital issue, and that's what we are attempting to address with this request. So we are requesting $50,000 in support of hourly wages. And as we kind of discussed earlier in the meeting, Bailey had mentioned the $13 an hour, I believe, is the cap on that hourly support. We are supporting a wage increase to $14 an hour, so above that cap there. So with that request, we unfortunately don't get much support from Medicaid with that essential worker in mind. So we are looking for outside support with that, as we don't have much input with those, as you would say, fixed rates with Medicaid. So any questions that I can help answer?
And Bailey, that's the premium pay up to $13 an hour or $13 more an hour. So what?
To mean an amount up to 13 per hour in addition to wages.
Okay, so it could be more than $13 more per hour is how I understand that. Okay.
How I understand it too.
Okay. And Colby, how did you figure this number? Did you could you tell me the time frame you used and how many people, part-time, full-time, just kind of a broad overall idea how you got to 50,000?
Yeah, so we're looking about 160 full-time and part-time staff. That includes the direct support professional position, not including administrative, any positions that are higher than that position. What we are looking for a time frame with that is about a year. The $14 increase was decided upon in relation to some of the budgets that we have with that. What we could support was that $14 an hour, but that is not necessarily sustainable with what we are currently outlooking financially. So we have this budgeted out for the next year throughout 2022. We are looking at a rate increase with Medicaid this upcoming February 2022, but that does not disclose necessarily how much our rates might increase with what we can provide with supports. So we are kind of in a limbo there right now with that, but that year is our time frame.
And if you guys were to look retroactively from April of 20 to June of 2021, would you have a sense of how many people are still working here at ARC that were working there back then? Or maybe just a sense, is that 7 out of 10? Is that everybody still working there?
So I'd have to get you a more concise number with that. I will say that our retainment rate with staff can be pretty low in these positions. People tend to come and go pretty quickly, and that has a lot to do with how much we pay hourly. I would say that the number of employees that have stayed since, you said, was it April 2020, is lower than that 160 that I had given you for the direct support professionals. But for a more definite number, I would have to get back to you.
Sure, thank you. We might end up having to give you guys some guidance on this going forward, sounds like. But thank you, Colby. Commissioner Rivera, anything?
I don't have anything. Thank you.
Thank you, Colby. Have a great afternoon.
You too. Thank you for your time.
You bet. Albany County Safe Project, shelter enhancements. Anybody here to talk about safe? Okay, we'll skip that. Skip the downtown clinic. Laramie foster closet. Anybody here for the foster closet?
I am. I'm just appearing to be a voice because we have a little sickness going around in our house.
Okay.
But yeah, my name is Jenny and I'm here to represent the foster closet. Our request was built on three different goals, and one of them was to have a director. A second one was to help pay for direct needs products right within our schools, and then the third part of it was to advocate for infrastructure help. And so that is our entire proposal. It's our goal right now just to make sure that every child in the ACSD1 schools have what they need, as well as foster children in the community. It has cost us a lot in the past for a lot of these products. I think that by almost getting the investment that we need would actually put us far enough ahead that we can stay ahead of the needs. We work pretty closely to recycle as much as possible from the community and donated goods, but some of the items we have found need to be new. We know that having a director would allow us to fundraise more effectively as well, since we're all volunteer currently. And we have seen I believe it's around a 33% rise in services needed since August. So we are really seeing a lot of needs in the community. And I believe that by meeting those needs, we can actually help parents have more financial alleviation in the community that, stems from hardship from COVID-19 and the pandemic overall.
Thank you, Jenny. Commissioner Bear, any questions?
Yeah, Jenny, I'm sorry, I may not have heard you say, you're asking for 60,000, but you put down 20,000 for equipment and 20,000 for contracted work. What's the other 20,000?
Infrastructure. So we need more bins, we need more shelving units, we need a lot more than we currently have at the foster closet to operate effectively. We've added the ACSD1 schools, but basically we would need to double the amount of bins we need. Our original investment in bins was around $8,000 alone without shelving unit. And we got that grant from Walmart. But since we have really exploded as far as how many people use us and how many social workers use us, we're seeing that we need some garment racks in the schools. We need some bins at the schools, ways to transport things more effectively for all the schools. And we also need to separate, shirts from pants and bins and have, all the sizes have their own bins for each item to make it easier for us to sort, organize, and get things out the door quickly. I think we've served about 200, and I think we're at 223 kids since the beginning of September, just for Cody's Closet alone that we've served so far.
And where in the schools are these, is this these bins and access to clothing and whatever is needed? Where in the school are they housed?
Sure. Each school has its own process. We work with the social workers and guidance counselors as well as the school nurses. So the school nurses, we equip them with underwear, pants, sweatpants, that type of thing in case there are any accidents or immediate needs. We stock each school with what they need. So everybody has every size of sock, every size of underwear, and every size of shirt, sweatshirt, pants. And that's to meet the immediate needs. And then our volunteers show up with 7 days worth of clothing and new shoes if the child needs 7 days worth of clothing and new shoes. So all of it's freely given. A lot of it's resourced from our very giving community. And so being more organized and having more areas at the schools and having those racks and some bins at the schools would make it so that we can serve more kids ongoing, but they're basically stored in the school nurses or guidance counselor's office.
Okay, thank you.
Mm-hmm.
And Jenny, can you talk to me? Do you guys work with the clothing cottage much or at all?
Not as much. We did in the past. What we have found is that our donations come in and leave a lot more quickly. And so it's really important for us to just stay on top of what we have, know our needs. And if we do have needs, we've partnered with New to You, and New to You actually can help us meet our needs at a faster pace. So they've worked with us so that we have, an account there, and we can change things out faster if we don't have something in stock for a child we need. We're completely open to working with the Clothing Cottage again. It's just, it's taken a lot more time than to meet those needs and to work with them than it did if we just worked with New to You so the kid can go get what they need right away. I don't know if that makes sense, but yeah. Sorry.
But just to make sure I understand your request, it would be $20,000 for products that needs, $20,000 for infrastructure, and $20,000 for contractor services that would service the director. Is that how I'm understanding it?
Yes. So it would allow us to branch out more and have time to network more in the community, which is a goal that we currently can't meet because we're so busy serving. And it would allow us to work more effectively with other nonprofits. It would allow us to fundraise, and the $20,000 for products would allow us to have socks, underwears, shoes. And I mean, this year, our biggest need has been snow boots. I don't think I've ever seen so many kids with holes in their boots before. And so we are, I think it would make a huge difference here to have those things be met for our kids just from, the ground up.
Thank you, Jenny. I appreciate it. Hey, have a great afternoon.
You too. Thank you.
Thank you. Greater Wyoming Big Brothers Big Sisters Care Coordinators. Steve, are you still there? Yep. Or Hannah? Guessing both of you.
I'm here. My camera is trying to connect, but can you hear me?
We got you, Hannah.
Okay, so I don't think our initial request has changed. We are wanting to follow up with Bailey a little bit more about the premium pay and what that might look like if we have people who qualify. But our initial request hasn't changed. To remind you, we are looking for some funding to support contracting with some qualified social workers to help us mitigate the damage that we have seen families going through in the last couple years and ongoing, and some of those concerns that are maybe not, they don't necessarily have a home yet in the community as far as the services that are available. We're seeing quite a few families who are just not really sure where to turn. And we know that there are people in the community to help them, but they're not sure where to go for that or how to approach those services. So we would want to be contracting with people who are qualified social workers to kind of coordinate care and set goals for the family to try to help get them back on track and back to where they would have been or beyond, if they can set some goals and kind of thrive and move back to a new state of normal in a healthier way.
Thanks, Hannah. Steve, anything to add to that?
No, I don't think so. It's worth knowing the history that we initially proposed for employed staff, and then were contacted and told that that wasn't going to be allowed, so we changed the language to contractual. I do want to point out that in our proposal, we said per year. Not real sure what the timeline was when we submitted it. I think today we could say that we would probably end up just doing that for 1 year to try to mitigate the needs that we're overwhelmed with right now, and make sure that there's a termination date on the end of those contracts so that we don't end up having to worry about sustainability or unemployment concerns.
All right. Commissioner Richardson. Excuse me, he's not here. Commissioner Rivera.
I am hoping you didn't confuse us. No, I don't have any questions.
I don't have any questions either. Thank you, guys. I appreciate it.
Thank you.
You bet. Action Resources, Feeding Laramie Valley, Sustainable Food Sovereignty for Albany County. Who's up with that one? Hi, Gail.
Hi, good morning.
thank you for this opportunity to continue to work with you and give us a chance to get a little bit more detail going in terms of what we're looking for and hoping for from ARPA funding. We and I just confess to still having a little bit confusion over the premium pay language versus how it's actually playing out for us here in Albany County. So some of the language may also continue to need to be adjusted for us. What we're looking at with Feeding Laramie Valley primarily is we really need to get recovery funds in order to get back on track with continuing with our sustainable program work. Because what we've understood all along is that while emergency assistance is needed, and it's been needed at unexpected levels for the last couple of years, that if we don't get out ahead of figuring out how to sustainably feed people healthy food in Albany County, we're just going to keep repeating this cycle every time there's some kind of disaster of any sort, whether it's another pandemic or it's just a food availability disaster, et cetera. So what happened to us was what we discovered was that, so for example, we had both a food cost challenge and increase in numbers of people that we just never could have anticipated. In March of 2020, just prior to things starting to really affect us all from COVID-19 in Albany County, we were spending about $130 a week in wholesale food costs that supplemented the food that we also produce. So that's on top of the cost of food we were producing. Last week, we spent $1,600. And so since about last June, it's been costing us over $1,000 a week to retain the level of quantity and quality of fresh fruits and vegetables for the people coming to us. And that together with the fact that we went from about 120 people a week who were receiving fresh fruits and vegetables from us 2 years ago to now we're getting near 600 people a week are coming to us just for shares. And that includes 85 stops and deliveries and a variety of other needs that are associated with that. So that in and of itself just blasted right through all of the funding and the work that we'd been doing to develop sustainable work, such as helping people learn how to grow their own food, creating a food hub so that we can bring in people locally who can provide healthy foods locally, and that will also contribute to economic development and so forth. So what we did with our opera funding is we went through three components that fall along with ARPA objectives, beginning with emergency needs and then working their way on up to long-term sustainable needs to help prevent this kind of thing from just ballooning in the future. So under the first objective, which is just the support urgent COVID response efforts, we have a request that is just trying to help us stay on top of masks and gloves and as well as home tests and clinically based tests for COVID. Feeding Laramie Valley never shut down. We never, and we also managed to not only hang on to employment, but we had to actually add full-time employees just to keep up with what was being asked of us. And in order to do that, we were already paying premium level pay. So we were already starting at $15 an hour as a basic pay rate for everyone, all frontline workers who were doing work with us. We also, that included covering paid sick leave for any time a frontline worker was exposed to, which happened frequently. We had a lot of frontline workers whose roommates were coming down with COVID-19. And so they had to go into quarantine, and we would have to replace that worker. So we were covering their sick time plus replacing them with another person we were bringing in to do the frontline work that was necessary. So a lot of the work that we did really helped to keep people safe. We never had an outbreak in the office to date, at least. It was always a roommate kind of thing, and we were able to prevent that from coming into the workplace. So we were able to both deliver to people. People were able to step in wearing masks and pick up their shares. Those who come to the building to do that, and that enabled them also to continue to get personal contact with people. We did a lot of referral out because people were coming in talking about a lot of the other needs they had, and so we did a lot of referring to a lot of the people you've already been hearing from today, and we're able to make that kind of thing happen. So we want to make sure we can stay on top of that. So we have a small $3,000 plus request for including an additional humidifier for the building, but most of it is the testing. It's an interesting, our experience in the county was that wherever we sent people to get tested, if they were immediately asked, is your organization covering the cost, which we were, because we didn't want anyone going in and having to outlay a lot of money to get themselves tested in order to stay in the workplace. So they were not accepting any insurances. They were billing us first. So we were being charged $80 per test to stay on top of keeping our staff safe and the participants that we were continuing to serve safe. So we put some money in still for that. Fortunately, now we have home testing available, and it seems like we're going to be able to stay on top of that. So that's the request for that kind of thing, along with continuing with gloves and masks and things that we need to handle fresh food every day. The next objective in terms of the immediate economic stabilization for households and businesses, that's really the recovery funds that I was speaking to. And as I'm listening to how it's actually being defined in your plan to utilize the premium pay approach, as I said, we've already spent all that money. We were already paying people a minimum of a $15 wage, and our people who've been working there longer, we're getting more than that, up to even $20 more an hour, and even more than that for leadership staff. So this kind of premium pay isn't really applicable, and yet the loss was great for us, again, because of how I described having to hire people when other people were out on quarantine and that kind of thing. So I'm not sure how to handle that, if we need to talk about contract fees or whatever would help with that. We're not looking for long-term support on that. We were being able to support that. We just now need to catch up with the losses that we garnered over the last couple of years. In that second part, we are asking for funding that will help us with our mobile market, which is the next step that we've got going beyond Feeding Laramie Valley Shares and our community gardens and our production gardens. Is actually, we have a bus that's been fully renovated. It's ready to hit the road, we believe, by April 1st. Some of the supply chain issues have slowed down that construction project. So we're looking for assistance with some fuel and again, frontline staff who now will be traveling throughout the county, bringing local, regional, and other kinds of organic and healthy foods throughout the county. So that's underserved neighborhoods in Laramie where people don't have access, can't get out to grocery stores, as well as the more rural areas. We'll be covering the entire county in that way. So those budget items are primarily for that. As well, we're asking for funds for fresh produce for the wholesale produce that we now must purchase, because the numbers of people who are signing up and walking in and continuing to come looking for high quality fresh produce for their families, we need time to catch up and recover from that expansion. Once the mobile market gets going, the whole plan behind the mobile market, in terms of, in addition to increasing accessibility for everyone, is that it's a mobile market for everyone. And so people who are able to come in and purchase food at the mobile market at the full price then that's going to help not only support the mobile market, but will also help support the shares component of our program, where we're providing fresh food at no charge to people who need it, who are living with severe food insecurity. So we're asking for $49,000 in wholesale costs to help us, again, recover from some of that unexpected COVID-related increase. And then objective 3, which is as the ARPA funds, also one of their objectives is, as they've written in the materials, is to really help mitigate the longer term impact. And I'm quoting here where it says the Treasury encourages recipients to consider funding uses that foster a strong, inclusive, and equitable recovery, especially uses with long-term benefits for health and economic outcomes. And that's the component that I spoke briefly to when we met last month or whenever it was, which is, in addition to the mobile market, is to do a pilot year of our planned food hub, which is about getting local foods to local institutions, both for profit to support the emergency care that we provide and that many of us provide in the county, but also to help support local agriculture and create economic development and increase jobs in that sector. And so that's the third piece, which I have now outlined, and I'm assuming you have the updated proposal with a very clear, a lot of it is about taking some existing resources we have. We have some modular buildings that I went back and looked at what could we use for resources to do a pilot year and not ask for quite as much as we thought we might have to, that the building site would come next after a successful pilot year. Then we'll move on to looking at a much more permanent food hub building and the other kinds of things that we would need. This would allow us to take one of our existing modular homes and put the equipment and the type of materials into it that would allow us to do a pilot year with a food hub. So it would allow us to do vegetable processing, which is what's necessary for local farmers and ranchers to be able to actually sell their foods to local institutions. So that's the rundown there. Again, because we stayed on top of staying open, paying people fair wages, giving them paid break time, covering sick leave, paid holidays, we're now in a position where we really need some recovery funds. And I'm not sure, my understanding of reading the ARPA guidelines is that it's meant to cover that kind of thing, but I'm not exactly sure how to ask for that in terms of how you envision actually dispersing the funds. So I'm interested in getting some guidelines for that.
Thanks, Gail. Commissioner Rivera.
I don't have any questions. Gail, thank you for your very well thought out description and delivery of it. Quite nice.
Gail, I guess with premium pay, we are not able to freelance like we might want to. And so I'm not sure how to answer your question. I'm suspecting we're going to have to give a little bit of guidance after this conversation this morning to nonprofits, because they do occupy a space that's different than the county employees. We were going to start with how we did the county employees as a starting spot, and maybe we need to adjust that. I don't know. We'll think about that. So I don't know how to recover your costs. And there are other places that do the same as you do, as you can imagine. So there are other nonprofits that pay above $15 an hour too. So I'm not sure exactly how to do that. Yeah, Bailey, you look like Gail.
Well, and
no.
Go ahead, Gail.
So I just had a very brief conversation with Evelyn as she was passing messages back and forth. And I didn't speak with Bailey, but my understanding was that there's now a difference between asking for contract funds because the premium pay, as you describe it, it doesn't apply to sending money back to people who were being paid more than sufficiently for the work that they were doing, higher than most places in town, and along with fringe benefits. Plus, this is just another, it looks to me like it's about $1.32 increase an hour at about $200 a month is kind of what I'm calculating roughly. And so, yeah, even if we were to qualify for those funds, it doesn't seem like it would go very far, and it just wouldn't be appropriate in our situation. And I think you're right. It's not just that people have been paying, that some of us are paying higher amounts, but also that so many of us who do the kind of emergency work that was absolutely needed immediately without question, as a result of COVID-19, are like, we're hurting. Last year, there were people were really generous. People are still generous, but the amount of donations has dropped precipitously this year. I believe the economic challenges are hitting more people this year than they did the first year. People are in a different place in their thinking. And yet our numbers continue to just multiply rapidly. And the idea of thinking about that our only response is going to be start telling people, sorry, we can't give you fresh fruits and vegetables. We can't provide this. I mean, the people and how grateful they are, and how it's literally saving their families who lost jobs, or the ones who are still trying to work 6 jobs, and they've got people who are sick in the family, and or people who are pregnant, and just it's just mind-boggling to me. And I know many of the people sitting in this room are seeing exactly the same thing for the kinds of services they provide. So I'm hoping that, and I'm happy to rework however I need to write things and depict them, but even in terms of the emergency funds that I'm hoping, that I believe that this is what this was designed to address, can be that we can work it out so that we're able to catch up with the kind of how we got hit by staying open. We got hit really, really hard, and we need to catch up with that so we can continue to move forward and do the sustainability work. So as I said, I'm more than happy to write things differently, to do, to word things differently, to come up with a different approach. But bottom line is, I know that many of us are really looking for recovery funds as well as this new, our new ideas to help address this kind of thing. So we're better prepared next time around. And I don't want us to fall into the trap where we often fall into with grant funding, which is, okay, a funder has an idea for a program they would like to see done. So we stretch and move ourselves around to add another program while our basic needs are still not being met. And I think that's one of the biggest challenges for nonprofits is no one wants to pay for the infrastructure that it takes to do that. Very few want to pay for salaries at all. They don't want to pay for buildings. They don't want to pay for, it's like, no, we want you to do the program, but we're not going to pay the people who need to do it. Like even the bookkeeper that's needed, no one funds that. So the excitement, I think, about ARPA funding from the way we all look at it is that this is an opportunity to help us all take a deep breath, help get recovery funds, and move forward with some new sustainable ideas.
Well, I wish there were more, and all of that might be possible, but it might not also be possible. And so I don't want this to be set up like the Hunger Games, right? Where we take one from the next, because that's not our goal as commissioners, is to do the best job we can with the rules and regulations and the funding that we receive, Gail. So we'll try to do the best we can with you. I do appreciate your willingness to adjust your ask. And then just as a citizen, I appreciate your willingness to pay a livable wage, right? That is truly the sustainable way to go about doing nonprofit work. when you're trying to save the world, you shouldn't have to sit on a stool that's wobbly, right? So that's my basic premise on this. So thank you so much, Gail. I appreciate it.
Thank you for your time.
You bet. Next up, my front door, a learning center. And it's Brenda. Are you still? Yep, you're there. Brenda, the floor is yours.
Thank you, Chairman Gosar, esteemed commissioners. Thank you for having me. Our request is for the renovation of a property that we actually own that is not currently in a livable state. It will add to the inventory of affordable housing units. We intend to use the property to prepare homeowners to be ready to purchase not only that property eventually, but also by being able to provide the financial literacy classes and whatnot in that property. We're also going to develop the undeveloped lots beside it. So while the request here would certainly allow us to renovate the one we own, says subsequent properties will also add to the inventory of affordable units for low to moderate income families in Albany County. So for us, we kind of looked at the goals and objectives and parameters set forth, and we feel like this meets pretty squarely those objectives.
Commissioner Vera, anything?
No.
Yeah, I don't know that I have any questions for you, Brenda. It's pretty straightforward. You're at. You've probably followed the conversation about premium pay and all that stuff, and we'll probably have to provide some guidance going forward. Seems we have more questions today than we have answers. Maybe it's going good. This thing just keeps giving, but it's a nice problem to have, to be able to get money to nonprofits, and hopefully we can do it as best we can so it'll be helpful to them. Thank you so much, Brenda. I appreciate it.
Welcome.
And then it takes us down to Albany County Early Development Coalition. Oh, excuse me, is the SAFE project, anybody from the SAFE project here? Okay. And mine, the downtown clinic is unchanged. Albany County Early Development Coalition. Looks like Rachel and Evelyn, or who else would you like to speak on that? Rachel, you're muted. Still muted, Rachel.
Ha! Got to turn on the mic and the camera. Hello.
Oh,
did you guys get the written description as well? And we can resend that. I'll go over if not. So I'll just give the real highlights of this, and then we can answer any questions. So the big objective of this, it came out of conversations with Kim and I about partnerships with public health and the library. But the big goal is that we would build a coalition. So at the end of 5 years, we would have a solid coalition of all of the organizations that work and impact early childhood development. So that would include education institutions like the library in terms of early literacy, Head Start. It would include daycares in town. It also, and a really key point, we'd include public health as well as pediatricians, eye doctors, dentists, all of those that provide care to that age group as well. So the hope is really to provide a really solid support network for 0 to 5 kids in Albany County and their caregivers. So really, and also being really intentional about focusing broadly on caregivers that are 0 to 5 kids in a 24-hour day are taken care of by older siblings, by parents, by grandparents, by daycare providers, and so wanting to have sort of that big support network. So the idea, because we do have some time to spend the money, would be to build really slowly. So start early on with a partnership with public health and the library to just do some first test programs and be able to roll out slowly. And then to slowly build out to a planning commission, which will include, again, people like Head Start, parents as teachers, and then continue to grow. So actually kind of building on the model that happened with the pandemic with all of the social services agencies and the biweekly call we have, following a very similar model, but focusing on just those early childhood providers so that we would have a broader coalition that was providing support, and then again, a planning team. So the idea is that it feels like there's a lot of opportunities. We're all doing good work. So it's really just to pull everyone together to coordinate those efforts. And then a big part of this, and where a lot of the financial piece of this comes in, is working across those agencies to develop a more robust incentive program. So the idea of, and again, sort of also borrowing a little bit from the vaccine project and some things that have worked in our community, providing some incentives that also maybe help counteract some of the barriers. So, you know, but being able to coordinate transportation. So whether that's us going out to some of the trailer parks and working with Laramie Connections, or going out to some of the housing authority apartments and doing story times and caregiving out there, or arranging transportation into public health or into the library to be able to do some of those things. Being able to work with Cole over at Family Promise to have access, you know, make sure people are aware of the diaper pantry, and then also, you know, being able to provide incentives, being able to provide snacks. We were talking about especially for our low income families, snacks for kids, but also snacks for adults, snacks for our moms who are holding babies. And so one-handed snacks. So just being able to provide work together so that we're holding a whole network. And sorry, it's really hard when I talk to camera, I ramble more than usual. So I'm going to stop there. There's a lot in here. There's a lot money-wise, and I'm happy to email there. I think it's to re-email that to the commissioners. But happy to answer any questions about that and where that would go.
I think we got it, didn't we? Yeah.
Yeah, we do.
Okay. Yeah, we've got it, Rachel. Thank you. Sue, any questions?
No, I don't think so. Rachel, I haven't seen this before. I mean, I did look at it real briefly this week, but I want to take more time to read everything that you have laid out here. And when I have questions in the future, I can send those directly to you.
Perfect. And yeah, I guess the only other thing I'd add on the budget is we ran with trying to carve out, I mean, I guess my thought is here is we ran to try to carve out some funds that would get us going. And what happened as I was building it, some of those are library centric. I can see a world where, and working with Bailey to making sure that we're all on these rules, as we get more players in the room and we just haven't had the time to coordinate at that level, that some of those costs and the specifics of how those go might adjust a little bit, where once we get Head Start in the room, once we get parents as teachers, we decide we want to do slightly different incentives, or some of the programming costs that we had in the library, we find other funding for so that we could move that funding to other programs within the initiative. So really what I was trying to do is kind of carve out a big ballpark figure to give us some time and space to get the right people in the room to start really planning what this could look like in the next 3 to 4 years.
Yeah, go ahead, Sue, please.
Thank you. So Rachel, what do you anticipate being the budget for the first year? I know you've got a 5-year, 6-year plan here. What would you be asking for just that first year to get all the stakeholders in the same room?
Good question. Give me a second to do some math. I think the way that I carved it out, it looks like about 27,000 is what I had carved out for that first year.
Okay, thank you.
Yep.
Thank you, Rachel. I need to read your stuff too. I looked over briefly this weekend also. So.
Yeah, no worries. I just didn't want to spend too much time talking at you for what you had, but happy to say more or answer questions. So.
Okay, thank you so much. I appreciate it. And then the final one is collective impact, United Way, Evelyn.
I don't have anything additional to add from what you guys already have. The request was for 2 years, over a 2-year period. And for that, the half of it for the data research compilation and also creating a community message, and the other half for contracted and organizing community members.
Okay, awesome. Sue, any questions?
And Evelyn, I'm to understand that all your funding for this ends this coming year.
It ends in March. We have a private donor who has funded it for 1 year. And we're meeting their requirements as we go forward. But our hope really, it's really hard to find that money for that data side of it and the cost and what it's actually going to take. And so hoping that this might help kind of in that realm of, you know, again, we all know there are disparities, but do we always have the number and the ability to communicate what those are and what they actually look like?
Okay, anything else?
Thank you.
Yeah, I don't have anything else. Thank you guys all for joining me and joining this commission today. We sure do appreciate you taking time out of your busy schedules. Thank you for doing the work that you do. It makes our community better. I hope you have a wonderful holiday season. And it looks like we'll probably be getting out some guidance about the premium pay as we think about that a little bit more. As you can imagine, well, maybe you don't imagine, we thought about premium pay as a priority, not only at the county, but I'm not sure why it wouldn't be a priority with you all. And then we'll go from there and how to calculate that. I know you guys are different than the county in a good way. And so I think we might have to have a different conversation about premium pay and what that looks like. Anybody else have anything to say before we head off? Yeah, it's Ellen, please.
I know, do we have a timeline as when to get everybody an answer about premium pay, like if we're funding it or not, just as they head into the new year and make all these plans and have their staff and even some of them whose their programs depend possibly on the assistance? Is there guidance on what they could expect as they make their plans for 2022?
Sue, any idea on what? I'd like to get it figured out as soon as possible because everything flows from there. So if we have premium pay that's different than what we anticipate, then that allows us less or more money for projects, right? And so, you know, it's this two-sided coin here. And so figuring that out, I'm not sure exactly how we're going to go about it. Just try to do the best we can, talking with Bailey, and then we'll have it on a commissioner's agenda, probably not this next one, but probably on the 4th of January. Evelyn, is that too late?
I think it might be too quick. In my personal opinion, I'm thinking we're looking like more towards the second meeting of January, just because Christmas and people are traveling and I'm busy myself. I'm not gonna lie. I have some final reports due at the end of the year. I would think probably more by the second meeting of January, hopefully to get it on your agenda. I do know that we still want to do that risk assessment to get that out there as well. So, I mean, that's an email. Evelyn and I already talked about drafting up an email for premium pay and then maybe including that risk assessment and then having it due back to us by, I don't know, like January 7th, maybe, Evelyn. And then their next meeting is January 18th.
Yeah.
So I think it's going to be more like that, to be perfectly honest.
Is there anybody who cannot make it to January 18th with money? Because I really don't want to leave you in a tough time of the year without the ability to pay the light bill, right, as it were. So yeah, it looks like
we're tight. I'm trying to meet as every week. It's like another $1,200 food bill. So they're hard. It's hard times. And we're out there scrounging and begging from everybody. But it's, yeah, that emergency, the immediate stuff is really tight for us. I'm assuming there are others in the room as well, where that immediate need is pretty extreme.
Okay. Anybody else? Okay. Well, thank you all very much. I sure do appreciate it. We can't make any decisions today here. It's a work session. But the next time we have it on the calendar as a regular session, maybe we can at the commission. So thank you all. I appreciate it.
Thank you. Happy holidays.
Happy holidays, y'all.
Thank you.
Thank you.